Okay, I see familiar faces on Zoom, and I see some people that I just met, and they're familiar now, right here as well. Number one, I'm very happy to be here, and very excited to be here. Actually, this is, I think, the second time we came back for homeopathy, and sharing some of this information because it's very important. It's imperative for physicians, medical professionals to know homeopathy, to know what homeopathy is, how it's different from medicine, how it's different from functional medicine, and how it's different from supplements and everything else, because homeopathy is a science of its own, and it should be treated as such. So today I'm going to do my best to share some information on homeopathy, as well as walk you through sort of some history, and then talk about anxiety and how important it is. Number one is very important to me because of the fact that I'm sort of dealing with a lot of anxiety with certain acquaintances, and it's been a challenge. So it's important to be able to handle sort of anxiety and anxiety spectrum disorders, because we're going to see there's a lot of them. So it's dear and near to my heart. And then I'm going to go over some research with you guys and show you some of the research about the homeopathic medications that we're going to discuss today. I've done my undergraduate work, as you mentioned. I started teaching with CDH, which is Center for Education and Development of Clinical Homeopathy, since 2008. And now I'm one of their senior faculty. I started teaching here in Fort Lauderdale in 2010. And so I've been teaching in Fort Lauderdale with CDH homeopathy, and it's been fantastic. We have graduated a lot of, well, we've given diplomas and certificates to a lot of physicians, nurse practitioners, who have basically completed the course and have gone through sort of the course. I'm going to talk about the course as well with you. I've done a lot of lectures, and I've taken homeopathy to many different medical conferences. And again, I'm glad to be with you guys here today. My practice is here in the Bay Harbor Island, Bal Harbor area. I've come from the Hills. My practice was there for 20 years. And as of COVID, we moved here, and so we're here now full time. I do my background is family medicine, but I do what's called functional medicine, which is preventive medicine, anti-aging medicine, IV nutrition, hormone replacement therapy, osteopathy and cranial osteopathy, and clinical homeopathy as well. I do seminars and webinars for Boiron, which is the largest homeopathic manufacturer in the world, and they've been nice to support us and bring you goodie bags, and I'll go through the sort of the content of the goodie bag with you because they're related to the presentation. And I'm also the senior teaching faculty of Center for Education and Development of Clinical Homeopathy. And if you guys, any of you guys are interested to learn homeopathy or to add homeopathy to their practice, we can talk about it at the end with Ricardo and certain specific sort of plans that they have for you guys for being part of this presentation today. Received the certificate of appreciation from VA Miami with their integrative medicine program as well, which was about pain. And I've lectured around Miami, obviously, a lot, and different conferences. I'm going to pick up the speed a little bit here. So with Boron, there is an education portal, and you guys can sign up. You can learn homeopathy on your own if you wish. There's a lot of amazing webinars on there. I have a bunch myself. The homeopathic treatment of sleep disorder you see is mine. The homeopathic approach to treating anxiety for primary care physicians is mine. You'll see low back pain with homeopathy. You'll see acne and homeopathy. And there is a lot of material there that you can actually access yourself. CEDH, as I mentioned, is the biggest homeopathic teaching course in the world, and we're all over United States. We're all over the world, actually. We have a lot of different teaching facilities in Europe and obviously United States and Canada. The course, if you're ever interested in it, is an 8-month course. It's 1 weekend a month, and it's in person here in Fort Lauderdale. And we'll go through, first weekend is generalities, then there's ENT, pediatrics, digestive and circulation, and then there is women's health, oncology, and gynecology and urology, dermatology, pain management, behavior disorder, sleep, and depression. So there's a lot that we cover in homeopathy. We cover everything that you will see in a primary care physician, how to manage or help. The instructors who teach the course are internal medicine doctors, family medicines. I'm a family physician myself. We have pediatrics, we have allergists, we have dermatologists, we have a lot of different specialties all teaching the course. And if you guys like to learn homeopathy, you'll be in really good hands. You're going to learn a lot of information. We do obviously same thing that we're doing here, but we also do certain ones in the afternoon. So as a dinner plan, if you guys are ever interested, Ricardo is here. You can have his card is going to be in the bags, and then you can contact him. And so I want to get to our anxiety. As I said, this is really important to myself. Our objectives are going to be anxiety and stress in primary care practice, importance, prevalence, pathophysiology, and diagnostic criteria. Then we're going to talk about homeopathy, and then treatments of anxiety, research in homeopathy, and then some examples as well at the end. How many know what homeopathy is? How many have used homeopathy before? Okay, fantastic. And I see some people online as well who have used homeopathy. So this is an important slide. Anxiety disorder and anxious state, the most common type of emotional disorders, are under-recognized and under-treated. The most common medications to treat these medical conditions are highly addictive. And if you remember, we had an issue with opioid recently, and it seems like the next epidemic is going to be SSRIs, because we know that people go on one SSRI. After 5 or 10 years, if they don't stop, they need to either increase the dosage or add a second one. And then in 5 or 10 years, they need to add a mood stabilizer to the mix, and then obviously something for sleep. So then they sort of become, and we're seeing research that shows that in some of our patients, we can't stop these medications anymore, and patients have become sort of addicted to these medications. And remember, these were the medications that we decided we're going to use for a short period of time for a lot of our patients. Somewhere from 6 months to 2 years was the goal, but then you see that a lot of our patients are actually still on these medications. Anxiety disorders are the most common type of psychiatric disorders. Many patients with anxiety disorders experience physical symptoms related to anxiety and subsequently visit their primary care providers. And so it's important to also see if someone comes in with physical symptoms, to also have in mind that this might be anxiety disorder. DSM-5 now has disorders, separation anxiety disorder, selective mutism, specific phobia, social anxiety disorder, panic disorder, agoraphobia, generalized anxiety disorders, substance and medication-induced anxiety disorders to other medical conditions. And this is after removing the previously obsessive compulsive disorder, acute stress disorder, post-traumatic disorder, and other ones that are close to anxiety disorder from the change between DSM-4 and DSM-5. Pathophysiology in the central nervous system, the major mediators are going to be norepinephrine, serotonin, dopamine, and obviously GABA. Other neurotransmitters are obviously involved, but these are sort of the major ones. Anxiety disorders are the most common type of psychiatric disorders in the United States. The lifetime prevalence of anxiety disorder among Americans is almost 30%. Very high. Social anxiety disorder is the highest, the most common, and by age 11, about 50%, by age 20, about 80% of individuals have some issues that tells us there might be anxiety involved. The 12-month prevalence estimate of social anxiety disorder for United States is approximately 7%, and with 340 million people living in the United States, that means almost 24 million people are affected by anxiety disorder on a yearly basis. Some of the diagnostic criteria: restlessness or feeling keyed up or on edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep difficulties. So this is what we say when we say there's physical stuff involved as well, right? This is what we need to see. Then diagnostic criteria for panic disorders: palpitations, pounding heart, rapid heart rate, sweating, trembling or shaking, sensation of shortness of breath or smothering, feeling of choking, chest pain or discomfort, nausea, abdominal distress, feeling dizzy, lightheaded or faint, chills or heat sensation, paresthesias, so on and so forth, up to fear of dying, right? So again, you see a lot of physical symptomatology in patients who are suffering from anxiety or panic disorders. Acute stress disorder is psychiatric diagnosis that may occur in patients within 4 weeks of a traumatic event. Features include anxiety, intense fear or helplessness, dissociative symptoms, re-experiencing the events, and avoidance behavior, right? So post-traumatic stress disorder is another one that's very important, but it can show up with the same physical sort of symptomatology as well. It's important to know acute stress disorder. This is one of the points. These are the issues that need a short period of time of medical intervention, right? And then after that, the medical intervention should be taken away, right? So if we have someone with, let's say, what is a acute stress disorder that you guys can think of? How about after pregnancy? Baby blues, right? Postpartum depression. So that's supposed to be a short period, okay? I had this week in my last week in my office a patient who was kept on the SSRI that they were given for 11 years. And every time she asked the doctor and said, well, when are we going to stop this? The doctor said, well, things are not broken. Let's not fix anything, right? So this is what we talk about. It's a brain physiology that's going to change because every day you're changing that brain physiology, and eventually we're going to get downregulation of receptors, and it goes on from there, right? So it's important to have this sort of mental contract, at least with your patients, and say, I'm going to give you this for a short period of time, and then at a certain point, we're going to start weaning it off, and it's there just to help you out, but at a certain point, we have to stop it, and then for you to learn to cope with it through other means. Exercise, going out in the sun. There's so much that they can do that we can talk about, obviously. Non-pharmacological treatment of anxiety in institutionalized older adults. We know that cognitive and behavioral therapy works along with your medications or separate from your medication. Music therapy works as well. And then appropriate training of institutional caregivers as well is important so that they know how to handle someone who has anxieties, undergoing stress or panic attacks. Collaborative care for depression and anxiety. Obviously, it is important to know that to treat someone, all the healthcare providers that are helping that person need to be either communicating to one another, which we don't have time as physicians these days, but at least to be on the same page and at least try to work together so that that patient can come off of their medications eventually. Are there any questions so far? We're good. Okay. So I'm going to move on to talking about homeopathy. Homeopathic therapeutics may alleviate the symptoms of anxiety and stress, and we're going to see how. For a second, and I always show this, this slide, I want you to have a different perspective for a second. We're going to come out of subjective, objective assessment and plan. We're going to go into looking at a patient and at their situation differently, okay? So we don't need an assessment and plan. We just need to understand the patient and work with the patient specifically. This is a timeline of medical arts, and you see we started with Egyptian physicians and Imhotep, and those of you who have been to Egypt have seen Imhotep, okay? Then Ayurvedic medicine, Chinese medicine, Ayurvedic medicine, and then Greek medicine started, Persian medicine after that. And then we had early 1800, we had homeopathy, then we have naturopathy, then we had allopathy, mind-body concepts, and then osteopathy, and then chiropractic from osteopathy, and so on and so forth, right? So it's important to look at these things as well to see where medical arts were at the time, because a lot of the medications that are, well, not a lot, some of the medications that are in allopathy actually come from homeopathy, from looking at the provings and the way homeopathic medications function. So it's important to see where we are. Founder of homeopathy was Samuel Hahnemann. He was disturbed by the medical system of his time. Obviously, there was a lot of ether, there was a lot of alcohol, there was a lot of sawing things off, there was a lot of using mercury for infection. So we were actually causing a little bit more damage to some of our patients. He thought that there might be another way of dealing with this. If you look at his sort of era, and see what else was happening at the same time, Edward Jenner at the same time was looking at vaccines. So this idea of we're going to give small amounts of something to you or to the body, to our patients, so that we can encourage a reaction in their body was the theme of the time. So Hahnemann did exactly the same things. He started giving small amounts of natural substances to patients to see if they can do anything. And so principles of homeopathy are, and I'm sorry, I'm going a little bit faster because I think I did this last time as well. But if you have any questions anywhere, please stop me and I'll wait to get your questions at the end as well. So the law of similars, that means like cures like. The law of highly diluted substances, and that illness is specific to the individual. And we're going to go over these things because these are the basis of how we interview, how we prescribe homeopathic medications to our patients. Law of similars. Hippocrates, the father of Western medicine, has talked about it. Paracelsus, the father of pharmacology, has talked about it. And Avicenna, the father of Persian medicine. And I'm sure there are other people, other great physicians who have talked about like cures like before as well. The law of highly diluted natural substances, remember, vaccines are obviously that considered sort of highly diluted or giving minimal amounts of something to the body, right? And then the other part of this is allergy treatments, right? Allergy treatments are a treatment that we're giving to someone. Let's say if someone has cat dander allergy, what do we do as allergists? We give them small amounts of cat dander, and then slowly we bring up the amount of cat dander so that so that their body finds a way of dealing with the allergy to cat dander. And this has been very successful, obviously, so far. That's why a lot of allergists are doing it. So this idea of highly diluted substances will create an effect in the body has been there for a very long time as well. Illness specific to the individual. So when a patient comes in, let's say when you're in an urgent care or an emergency room and you're working that day and you're going to see, let's say, you know, 5 sinus infections in one night, right? And everyone is going to tell you something different. Your medication usually does not change. You're going to say sinus infection. These are the 2 or 3 top medications that I use all the time with my patients, so I'm good, right? But in homeopathy, it's different because one of your patients will come in and say, I have headache that's in frontal area, and when I bend down, the pressure increases. You have another one that comes in and says, I have postnasal drip, I have sore throat, and I have green runny discharge from my nose. And you have another one that says, I have ear pain, I have pain in my sinuses, and it feels my teeth are longer, and I have, you know, red discharge, sort of brown discharge coming from my nose, right? All of these things will get a different medication in homeopathy. They will not all get the same medication because the medications are chosen based on the specific symptoms of the patient. So homeopathy, homeo means similar and pathos means suffering. We're going to use diluted substances found in nature. And similitude of symptomatology is important, as I said. So we find the symptoms that a patient is suffering from and try to match that with the natural substance that will create those symptoms. And then we're going to give it in very diluted amounts to the patient to reverse those symptoms, right? Same as cat dander allergy. You're going to do exactly the same thing. So if cat dander bothers someone, you're going to find cat dander in very diluted amounts. You're going to give it to them, and their body eventually is going to start learning how to deal with cat, right? So the same thing here. The other things in homeopathy, for those of you who would like to join our course, you're going to see we talk about targets, sensations, modalities. The other things that are very important are improvement modalities and exacerbation modalities. We always ask our patients and we say, well, what makes it better? What makes it worse? Because that's important to us and it directs us to finding the perfect medication for them. And we said homeopathy is there to stimulate the physiology. And the other thing is that I want to bring to your attention, supplements are not homeopathics. You're going to have your patients who come in and they say they're using homeopathy. And then you say, what are you using? And they're going to say turmeric. Turmeric as a substance is not homeopathic. Homeopathy is a diluted version of a natural substance. So anything that comes in a is not considered homeopathy. Although we think if it's natural, we have to call it homeopathy. That's not the way it is, right? Supplements are supplements. It's like giving that much cat dander to someone, right? In homeopathy, it's different. We dilute it and then we give it to someone. Yes.
Are the substances usually considered things that could be toxic to the body at a higher dose, but because of that dilution, it's well tolerated?
So what's your name?
Shanine.
Shanine, that's right. You said that. Well, Shanine asked a really good question because apparently she can see my next slide. So she said, there you go. So maybe I can explain. So the question was, are things given because of their toxicity, right? So in clinical homeopathy, and there's clinical homeopathy and classical homeopathy, there's a little bit of a difference between clinical and classical homeopathy. Clinical homeopathy, which is what I practice, is when we use a substance that has pharmacology and toxicology. And we know it's pharmacology and toxicology, so we're going to use it. Clinical homeopathy has around 300 medications. Classical homeopathy has more than 1,000 medications, okay? But clinical homeopathy only uses medications which have given us pharmacology and toxicology. So here's my challenge to you. Can anyone name some pharmacologically active natural substances that we use daily? Coffee, yes, thank you. I'm glad I directed you to that, huh? coffee, right? Coffee is what we use naturally on a daily basis. And in homeopathy, it's Coffea cruda or Coffea tosta. Its chemical components is caffeine, trigonelline, and theobrome. Okay. And the composition is very close to theophylline, which is one of the medications we used to use for asthma attacks, right? So we know the pharmacology of coffee. If we know the pharmacology of coffee, do we also know toxicology of coffee? Can you guys tell me toxicology of coffee? What happens if I have one coffee? You get dehydrated. Okay. Okay. With one do you feel? It's more strong, let's get things done, and sharp. How about two? You're overly stimulated at two. Aren't you third year residency? Oh, you don't drink coffee, that's fine. But so you can appreciate as you increase the as you go in the amount, the dosage of the medication that you're giving, you're going to start having toxicology. Let's say someone has what are insomnia, anxiety. Why don't you give me, now that we're talking about it, remember, it is not a nosological diagnosis. It's not sinusitis. It's okay. Give me some physical symptoms that you feel when you had too much coffee. Jitteriness, rapid heart, there you go. Rapid heartbeat. The heart might even skip a beat at a time. What else? Sweating, headache, diuresis, as you said. You can have acidity in your stomach, right? And then you won't be able to think clearly because now you're overstimulated, as you said, right? So you see how homeopathy, and that's it, because we care more about the symptomatology as opposed to the diagnosis, right? So, Coffea crude, that means coffee in homeopathic dilution. That means we get coffee diluted by 1 to 100, we dilute it by 100%. We make it 1%. Then we get that and make another batch of it. We make that, we get that, make another batch of it, and we make till we get to 12 or 13. So if we have symptoms of Coffea, when someone comes in and says, I have agitation and anxiety, it feels like I'm overexcited, I can't fall asleep, hypersensitivity to noise, right? Even getting startled. We know that Coffea is a specific medication that we use for people who have these specific symptoms, along with, and this is not a sleep presentation, but Coffea is one of the medications that we use for sleep, right? Because it's for your patient who goes to bed, but they have physical hyperactivity and mental hyperactivity, and it's hard to fall asleep, right? So Coffea medication, and I think I have all of these medications that I'm going to talk about in our bag. Ricardo has been nice enough to bring all these medications for you guys, so you can try it on yourself and your relatives and see what works and what doesn't. Physical hyperactivity with tachycardia, extrasystoly, trembling of fingers, and polyuria. So when you see someone is going through like it's not a panic attack, but it's an anxiety attack, right? Coffea is one of the medications that you can use very easily for that person. Another medication that we have is called Aconitum. Aconitum has aconitin, tyramine, and dopamine. So its physiological effect is over pharmacology and toxicology related to these specific constituents. Aconitum is used for sudden and intense reaction sensation of tingling and numbness of lips, face, and the limbs, anxiety with fear of dying, dizziness, weakness of muscles, tachycardia with a hard, tense pulse and red face, and hypertension. What does this remind? A panic attack, right? You see, it's much more severe than Coffea. Coffea was a mild thing comparing to this, right? This is a person who's going through severe attack to the point that he or she feels that they're going to die, right? Okay, so that is Aconitum. So if a patient comes in complaining of these things, we're going to give them Aconitum. Nitricum or silver nitrate has been used in medicine for a very long time, obviously, because of washing out bladder and this ophthalmia neonates, and I think we still use it in NICUs as the babies are born. We still use this as well. Argentum nitricum should give you a picture of almost obsessive compulsive personality. An agitated and anxious person. This is a person who has anxiety that compels the subject to walk quickly. That means this is a person who's, when they get anxious, they can't sit down. They have to be mobile. Nervous anticipation and agitation, phobic neurosis and phobias. They are in a hurry to the point of being inefficient. That means what? That means your patients who go to, they've studied really good, and then they go to the test to take the test. They sit down and they write everything very quickly. They do a great job. They get up, they sort of give their test, and then once they leave, they say, "Oh, I forgot to put this down, and I forgot to put that down, and I forgot to put this down." Right? So it's the anxiety, the hurry that takes you away from present moment, right? Obsessed with fear of being late. These are the patients that are going to be in our office 10 minutes earlier, always, as opposed to some of your patients who are going to be there always late, right? They can feel, a nervous urination right before. There can be spasms, asthenia. So this is for your patient who is sort of always in a hurry, and because of the fact that they're in a hurry, they're going to be inefficient. But it's an anxiety, right? It's hard to give a medication for something like this to your patient, but you see a lot of patients that have these, they come in with these symptoms, right? What medication can we give them? It's going to be hard because this is very situational, number one. And then you see it's more a physical thing that's happening to them. Gelsemium is a very important one. Yellow jasmine, it has gelsemium, terpene, and gelsemicysteine. It interferes with cholinergic transmission of the nicotinic and muscarinic receptors. And I'm going to show you some research about this as we go along. But gelsemium is a little bit different. It's almost opposite to Argentum. Gelsemium is worried about things. Gelsemium is worried about what's happening in the future. Okay? This is your other kid that goes, if you have two kids, your other kid, also smart, studies a lot, and then goes and sits down and then reads the first question and says, I knew it right before I read it, just right before I came in. I can't recall, right? So that's another issue that we have here. Nervous apprehension with inhibition, memory disturbance, headaches that are occipital and go to the neck and shoulder, heaviness of limbs, weakness and tremor, bradycardia. It's a patient that needs to sit down. They get this weakness, heaviness of limbs, weakness. So this is your patient who gets anxious, anxiety, and they need to actually sit down, right? Completely different than Argentum, which is, they're anxious, they need to move around, they need to walk around, they need to get something done, right? So Argentum is fast and inefficient. Gelsemium is the opposite. Gelsemium forgets because they get anticipation anxiety. It's the person who goes and to give a presentation behind the podium like myself here and forgets what they want to say. So I loaded up on my Gelsemium on the way coming here so I don't forget everything I want to tell you guys. So performance anxiety is Gelsemium, right? Califos. Calcium phosphoricum is potassium phosphate, a constituent of the nervous tissue, muscles, and blood. Califos has physical and mental asthenia, which is what we call in functional medicine adrenal fatigue. Okay. Headaches, memory disturbances, insomnia, hyperesthesia to noise and contact. They're jumpy, they're irritable, sensation of a ball coming up in the throat, occipital neck pain, sensation of heavy head and eyes, and sexual asthenia with retained desire. So this is a patient who is tired and wired. They're tired, but they can't fall asleep because they're anxious, they're irritable, they're jumpy, they're, it's a completely different feeling than Gelsemium, than your Argentum, nitricum, and other medications, right? Any question?
These type of patients, like how they're presenting and what you use.
Is there a time where there is overlap between medications? Of course. And that's one of the differences between clinical homeopathy and classical homeopathy. Classical homeopathy searches to find one medication that covers the totality of the symptomatology of a patient. Clinical homeopathy, on the other hand, we might give you 2 or 3 or 4 or 5 based on what you're going through, right? So yes, they are going to, and at the end of this presentation, you're gonna do some of the patients yourselves to see how it's done. So other medication, obviously, the list is much bigger in homeopathy. The ones that I introduced to you are a good start for anyone who wants to work with anxiety. Those are sort of the top medications that we use. But obviously, we have a lot more medications that we use for anxiety and panic attacks and everything else. Homeopathy can be used in primary care practice and in specialty practice. We actually have a lot of physicians that go through our course and they add it to their specialty as well. Homeopathy can be used in as first line. So if one has, let's say, a UTI or they have a sinus infection, you can use it as your first line. And then with the backup of your antibiotics, you can say, well, we're going to start with this because that are such, and those are covered by this specific homeopathic medication I'm going to give you, and this is your antibiotic reserved for you at the pharmacy. If in 2 or 3 days things are not getting better or they're getting worse, you're going to go directly to your medication. Samuel Hahnemann said the highest ideal of cure is the speedy, gentle, and enduring restoration of health by the most harmful way. And I want to go over this with you. To present to you a point why we need to have something else as physicians and as healthcare providers to help our patients with. Globally, medication-related issues continue to be a significant number of deaths each year. Some of the key statistics are World Health Organization estimates that medication errors cause at least 1.3 million deaths annually worldwide. In the United States, a study from Johns Hopkins suggests that medical errors, including medication, the third leading cause of death, contributing to 250,000. We can give you some homeopathic medication, huh? So contributing to 250,000 to 440,000 per year. So that's huge. Not only it's huge for United States, it's huge when you look at worldwide, it's 1.3 million. And in the United States, it's 250,000. So it is as if 1 out of 5 people that die in the whole world die in the United States from medication abnormalities, right? Adverse drug reactions alone are responsible for around 100,000 deaths annually. Globally, medication-related harm is estimated to cost healthcare system over $42 billion annually. Now, if you do the same search for homeopathy, it's going to say deaths directly caused by homeopathic remedies are extremely rare or unheard of, primarily because homeopathic products are heavily diluted and often contain little to no active ingredients. However, harm can occur when people rely on homeopathy instead of proven medical treatment for serious conditions, right? So if someone comes in and says, I have chest pain, we don't give them a homeopathic medication. We send them to the emergency room, right? And I wish I had the slides for the homeopathy history in United States as well. Homeopathy was very big in the United States at a certain point, and hopefully, if I come back next time, I'll bring those. But it lost its effect just because we think people who were not medically trained started prescribing homeopathic medications, and they were not medically aware of certain things, certain conditions that can be deleterious to their patients. So they promised we can treat autism and we can treat cancer and we can't treat any of these things. Okay, not that I know of, at least in my years of homeopathy. And I practiced homeopathy since 2005. Okay. So when we sort of promise something we can't offer, that's the time that there is problem. So that's why in CEDH, Center for Education and Development of Homeopathy, we only train people who have prescription medication rights, because we think these have a very good understanding of body, they have a very good understanding of medication, they have very good understanding of when someone needs medical care and it's acute, and they should not go to something that is not going to be able to get the job. And in CDH, we train you always. When we go over any part of the CDH, any part of your systems, we talk about when to use medication directly. Don't even think, right? Because it's important to know. That's more important than. So, let's see, delays in proper medical treatment are leading to worsened health outcomes or death, and so on and so forth. So false claims as well, which I covered. So these are important to keep in mind. All right. Are there any questions so far? We're good. Okay, I'm going to go over research as well, and then so this one was homeopathic treatment of depression and anxiety. This one was a small, there was 12 adults who had major depression, social phobia, or panic disorder. And I'll read you the conclusion. Homeopathy may be useful in the treatment of affective and anxiety disorders in patients with severely symptomatic conditions. This one was homeopathic medical practice for for depression. This was a very large study. This was one of the large studies in homeopathy. This was done recently. It is you guys can hear me? So EPI 3 had 804 practice GPs. Thank you very much. No. Okay. So there were 195 GPs, which did conventional medicine, 352 GPs who did mixed practice. That means that they combined homeopathics with medication, and 256 GPs who only practiced or prescribed homeopathic medication. And there was 8,559 patients, and which were treated. So this was a very large study, cross-sectional study. It had 3 arms, one MSD, which was musculoskeletal disorders, one upper respiratory tract infections, and the other one was sleep disorder, anxiety, and depression, so SAD for that. And if we look at sleep, anxiety, and depression, patients treated by certified homeopathic physicians were less likely to be prescribed psychotropic drugs. But here's what you can see there, actually. What it showed was patients who used homeopathic only didn't use as much psychotropic drugs. Patients who got the best benefit were actually in the GP mix arm. That means GPs who were prescribing homeopathic medication and medication. So these were doctors who knew when to give a small amount of medication and which homeopathic medications, and they combined them. So the best approach was the best result came from GPs who were prescribing both medication and homeopathic medications. Again, solidifying our point that in CEDH, we train doctors or people who have prescription rights just because we think it's important for the benefit of the patient, for homeopathy to be prescribed by someone who knows medicine well and also knows homeopathy well as well, actually, right? But you also notice that homeopathy is pretty easy. A lot of homeopathic medications are what we've seen in pharmacology already, like Califos, you've seen Glonoinum, we've seen. You're going to see, if you ever join the course, you'll see that a lot of the medications are things that you already know. Belladonna, you already know and what it does. Atropine, you already know what it does. So these are a lot of medications that you're already familiar with. So I think I told you the result. This one was 40 students suffering from test-induced anxiety were given either homeopathic Argentum nitricum, which I showed you, or placebo. The level of test-induced anxiety was significantly reduced from the homeopathic medicine when compared to the placebo, and this effect appeared to persist over time. Test of homeopathic dilution of Aconitum. Who remembers Aconitum? I have something to give away. So I like to give it away to someone. This is a very good book, and I'll go over it with you. It's Frameworks and Protocols in Homeopathy. But I like to give it away to someone in the audience, obviously. So let's see. Aconitum was one of the medications we discussed. It was for what? Okay. Panic attack. And your name was? Karina. Well, you got Frameworks and Protocols of Homeopathy, and I'll go over it with you, and you see. Sure, you see. It's a great book. It's a great book. It has a lot of information. I'll go over it with you guys so that you see. So this one was a clinical randomized double-blinded controlled crossover study, and this was small. It was 33 subjects, and the conclusion was a clear difference between the reported short-term reactions of healthy subjects towards Aconitum and towards placebo was shown. The crossover design with intra-individual adequate to recognize this study. So this was the results. Crossover difference yielded statistical significance between the classified reactions towards Aconitum and to placebo. So this was a smaller one, obviously, but you see that a lot of the medications that I presented to you have some research behind them. Effects of homeopathic medicines on polysomnographic sleep of young adults with histories of coffee-related insomnia. This one showed see, let's go to young adults. This one showed Nox vomica, which you guys didn't see, but you saw Coffea cruda. Subjects completed daily morning results. Venom remedies significantly increased PSG, total sleep time, and non-REM sleep. So you see that, I think I told you that Coffea was the medication that we use for what? For physical hyperactivity and mental hyperactivity, right? So here you see a study that actually showed that using these medications helps with sleep and non-REM sleep as well. This was I think, a bigger study. This was pharmacoeconomic comparison between two drug strategies, one of them psychotropic and the other one homeopathy. So there's strategy H, homeopathy, or strategy P. 3 months, there were 394 patients, and the results, the homeopathic drugs strategy was statistically equivalent to the psychotropic drug strategy in terms of effectiveness and satisfaction for significantly lower direct medical cost reimbursed by the national. So here is another one that you see that homeopathy and sort of psychotropic medication sort of went head in head, but homeopathy is much cheaper than psychotropic. So this was done to make sure that, and you see that they wanted to make sure that they can continue using homeopathy in national health insurance system. This is another one. Remember Gelsemium? What was Gelsemium for? Performance anxiety with what? Needing to sit down and sort of being forgetful and forgetting things. Right. Effects of Gelsemium on pathways focus. See, this one showed the result in a negative modulation trend in neuronal excitatory signaling. So it showed that Gelsemium decreases neuronal excitatory signaling. So, and a new working hypothesis on the anxiolytic and analgesic action of this plant. So you have study on Gelsemium, which is what I showed. This is another one on Gelsemium. I'm going to go through these a little bit faster because I see I'm losing you guys. Gelsemium, this was in the behavior of mice in response to novel environments, and this was going against controlled diazepam and different dilutions of Gelsemium, and your mice that got Gelsemium had the courage to sort of go to different places of that study, as opposed to the other ones which didn't. This is a working hypothesis on where Gelsemium works. Remember, we talked about neurotransmitter GABA, and so we have an understanding of where Gelsemium works in the nervous system as well. Are there any questions? No. All right, so in front of my astonished eyes and ears, you guys are going to help some of our patients. How's that? So that we can use these medications. And these medications are all here. Yes, can you pass these around so that they can open it and see what's inside it? That'll be even better. A 30-year-old female complains of anxiety. Do we know anxiety medications in homeopathy? Yes, we do. Thank you very much. She's a CEO of a big company and has to present every Monday in front of the board. So far, has been using Xanax, but feels groggy and forgets certain important details. Wants to get pregnant and wants to stop Xanax. What medication would you use? These are our options. What do you think she has, and what do you think we should do? How many people say A? How many say B? How many say C? How many, you get C? How many say D? And E and F? Okay. So You go with A. All right, well, let's see. So there you go, performance anxiety, Gelsemium. This was one of my patients. She was, for 3, 4 years, I was telling her, I said, well, why are you using medication? You can get the same thing. Because she was complaining of the fact that whenever I use Xanax, I feel groggy afterwards. Or sometimes halfway through the presentation, I start forgetting things because then the medication would start bringing her down. And so continuously, I told her, I said, why don't we do a homeopathic medication instead? And she didn't want to do it at the time. But once it came time to get pregnant, she started sort of wanting it. And she came back and said, I kick myself for not listening to you for the past 4 years. All right. How about patient B? 9-year-old male bring in by mother for hyperactivity. Nurse at school has advised the patient to take the child to a psychiatrist to get evaluated for anxiety and hyperactivity. Mother does not want to put child on ADHD medication, stating he's not that bad. He just gets excited at times. This can be during school or at home or before going to bed. How many cases do we know like this? A lot. Do you do psychiatry? Clinical social worker. So you get a lot of kids who will get to go and see sort of the psychiatrist, and obviously, I think by default the psychiatrist has to give them a prescription no matter what. I mean, I don't know if psychiatrists can not prescribe medications when they see a patient like that, but in either case, you see a lot of parents who don't want to start their kids on the psychoactive medications at a young age. And a lot of the times, these kids are what? These kids are bored in school. So they become hyperactive just because of the fact that there's not enough stimulation, right? And once there's enough stimulation, that sort of they get sort of focused a little bit more, right? So what medication would you prescribe? B. What else? Anybody else goes for anything else? Absolutely. You guys are fantastic. I, I think you can be. I think we're all homeopaths deep down because a lot of these things, because of the fact that homeopathy is physical sensation of patients, it's much easier, and it also makes you bond with your patient easier because a lot of patients, I have patients that come in and say, I have migraine headache. And you say, okay, I understand migraine headache, but explain to me what migraine headache is. And once they start explaining it, you see it's not even a migraine headache. And then you say, well, where'd you hear that? I don't know. One of the doctors said it. So they become labeled by they become labeled, number one. And this is something they're always going to think. They're going to say it's migraine, and they're going to go from doctor to doctor, and they're continuously are going to go on different medications, as opposed to really figuring out what are these symptomatology? What are your specific symptoms? Let's deal with symptoms one by one and figure out what we can do, right? Yes. So the question is, in this case, it's a pediatrics situation here. Is there a dosing difference for pediatrics and adults? In homeopathy, there is no difference in dosing because remember, you're not giving anything significant to the patient. It's not like one of the antibiotics is 500 milligrams 3 times a day and the other one is 250 twice a day. There's no difference. In homeopathy, we give medication based on symptoms. That means I tell my patient, I take the mother of the patient. As soon as he wakes up in the morning, you give him 5 pellets of Coffea, okay? And then as soon as, if they can do another one in school, then you do another one in school, right? If they can't do it in school, as soon as he gets home, you give him another 5 pellets of Coffea. And then right before going to bed, you give him another 5 pellets of Coffea. Okay, so someone like this, I'll have on sort of 3 times of Coffea per day. Now, what happens if I have someone who has UTI and it's severely burning? Do I also give it to them 3 times a day? Yeah, you can give it every hour, right? We give it every hour. Well, the homeopathic, not Coffea, obviously, but the homeopathic medication that we use for burning sensations related to. And can someone guess what that medication is? What if I tell you the patient comes in and it says, it burns when I pee? What's something in nature that burns? You're close. Capsicum, exactly. So homeopathic medication that we use for someone who has UTIs, urinary tract infections that feel burning, is homeopathic dilution of capsicum. Okay, so I'll give that every hour because UTI is burning and every time they pee. So it's important to give it more as opposed to less. And a lot of the times you'll see that when we say, you use medications like the medications for cold or for sinus infection, at first we say use it every hour or every 15 minutes and then slowly decrease based on how your symptoms improve. If there's improvement, you decrease until you get to complete improvement and then you stop. So in homeopathy, we don't say take this medication 3 times a day for 10 days. So remember the homeopathic dilutions of things are there to stimulate the body, to stimulate the energetic forces in the body to do something or to bring the attention of the body to a specific thing, right? So now the body says, oh, cat dander, mm, cat dander, small amounts. Let me use the small amounts of cat dander to kick off allergies to cat dander. You see, so you're letting the body do its job properly. So a lot of times we say homeopathy is not anti; it's actually pro. Giving. Um, the homeopathic dilution that we have is capsicum. Right. And remember, in homeopathic dilution means there's almost nothing left, huh? Patient C, 46-year-old male, complaining of panic attacks. A physician who travels from California to Florida on a monthly basis to teach has a hard time falling asleep the night before due to stress and fear of flying. On the plane, he gets panic attacks with rapid heartbeat and sensation that he's going to die. What medication or medications do you recommend? Panic attack D, he says. Huh? C? Some people like C. Some people like both. It's clinical homeopathy. You can do based on the symptoms of your patient. You give them a medication, right? So anyone can guess who this doctor was? Is that's me. So for a long time I used, huh? Is it yours? So yeah, it's fly. So I started coming here in 2010, and I told you to go back and forth, and flights can be nerve-wracking to some of our patients. Okay, and your choices are, they always say they either do alcohol on the plane or before they get on the plane, or Benadryl or one of the benzodiazepines for the anxiety, right? But a lot of, including and I tried Benadryl as well, and Benadryl actually revved me up. It made it worse for me. It was horrible to feel trapped somewhere, being anxious, and also be tired. It was horrible. But in either case, um, it is a feeling that number one, the night before, you're not going to fall asleep because it's anticipation anxiety. So you're going to use Gelsemium the night before, okay? And then I even did like Gelsemium because it's still anticipation of getting on the plane and anticipation of the whole flight because it's 5 hours going back and forth between California and Florida, right? So it is, for me, it was 5 pellets of Gelsemium the night before so I can fall asleep. And then Aconite and Gelsemium from the morning that I had the to fly Uber, driving, as soon as I get on the plane. And if I felt it again during the flight, I took another dose of both, right? And this was life-saving. I mean, it changed my life, right? So, and this is something that you should also try with some of your patients who have this. The combination of Gelsemium aconite, Aconitum is a very important combination for anxiety attacks, especially related to these things. Patient D, 67-year-old male, complained of insomnia, fatigue, being anxious, and jumpy. A lawyer who's been very stressed out over the last 4 or 5 years, had a hard time falling asleep the night. I cannot shut off my brain, tired most of the day, but at the same time, very jumpy and moody with anger fits for trivial issues. Any takers? Who? You do Califas? Okay, what else? Insomnia? You do what? Coffea? There you go. Exactly. So insomnia, Coffea, and adrenal fatigue. It has all the symptoms of being wired and tired at the same time. And that is Califas. I want to bring your attention to this. No matter what part of medical arts you do, if you're an acupuncturist, chiropractor, medical doctor, homeopath, osteopath, you have limitations, okay? There's limitations all the time. We have to appreciate that limitations are also there in homeopathy, okay? And coming back to everything that I said during the lecture was also, you have to know your homeopathic medications. You have to know that at a certain point, a person needs something higher than that. And as a medical doctor, you also have to know that at a certain point, your patient needs to be downgraded from a medication to something that is not as serious as an acute medication, right? So know your limitations wherever you are, whatever you do, homeopathy, osteopathy, family medicine, or LCSW or anything else that we do, it's important to know that, but we can rely on different things. And the reason my practice is combination of osteopathy, homeopathy, medicine, and hormones and IV nutrition is because I want to be able to handle a patient completely. I want to be able to give them something for what they have without needing to overdo it at times, right? So know your limitations. And then I guess going through, I think everything I've said is sort of your recap. We know anxiety is there. It's undertreated because, you know, your patients don't, your 11-year-olds and 12-year-olds and 15-year-olds don't come in and say, I have anxiety. They say, I have abdominal pain, I have nausea, I have this, I have that. And then you start treating them for something else, right? So know that it's under-recognized, under-treated. Know how you want to treat it. Know that there's medication, there's also supplements, there's homeopathy, there's so many different things you can do. There's cognitive and behavioral therapy, there's music therapy, there's whatever, there's so much that you can do for your patient. So don't slap a medication on them and keep it for 11 years. Okay, that's not the right way of practicing medicine. We have to be able to handle our patients properly. And homeopathy is there to help you. Um, if anyone, again, wants to sign up for the course, I think they have a special rate for people who want to sign up either from the Zoom or those who are here for the course. You can talk to Ricardo and he will set you up. My practice is called Body of Harmony. I do have a lot of YouTube videos, some on homeopathy, some on functional medicine, some on osteopathic treatment, so on and so forth. So you can always refer to those. And as I said, Boron has a really good webinar series as well. It's really good if you have any homeopathic questions to watch those. I want to take your questions, but first I want to thank you. I want to thank Dr. Junko, who's on Zoom and not here with us. I hope everything is okay, and everyone who's on Zoom and everyone who is here. And it's I'm very happy to be here and be back with you guys.